Hospital Infection Control Committee. The Hospital Infection Control Committee HICC is also referred to as a Infection Control Committee ICC is an essential organizational body that every hospital must establish to manage, prevent and monitor hospital acquired nosomial infections and hygiene practices. Its primary function is the production of implementation and continual updating of policies that govern infection control across the entire hospital. The Hospital Infection Control Committee, HICC, also referred to as the Infection Control Committee, ICC, is an essential organizational body that every hospital must establish to manage, prevent, and monitor hospital acquired nosomial infection and hygiene practices. Its primary function is the production, implementation, and continual updating of policies that govern by infection control across the entire hospital. Composition of the committee, HICC require a multidisciplinary approach and typically consists of the following key hospital personnel like a medical microbiologist required. Medical microbiologist usually serves as the chairman of the committee, and clinical representatives. Clinical representative include a physician and a surgeon. Nursing representatives, nurse teacher and specific nurse representatives from departments such as surgery, obstetrics, gynecology and medicine. Sterile service manager. Sterile service manager ensures the provision of sterile instruments and material. Purchasing officers may be invited to attend meetings when the hospital is procuring disinfectants or related infection control supplies. So, the medical microbiologist, clinical representatives, nursing representatives, sterile service manager, purchasing officers. Core rules and responsibilities. The committee meets regularly and carries out several vital functions like formulating and monitoring policies. The HICC establishes and tracks adherence to specific procedures designated to prevent infection. This includes creating and enforcing comprehensive disinfection policies, rational antibiotic policies, and catheter care policies. Active surveillance. Active surveillance, like a major responsibility of the HICC, is conducting continuous surveillance of the hospital acquired infections. The committee monitors 4 key parameters for HAA surveillance, that is, catheter associated urinary tract infections, central line associated bloodstream infections, ventilator associated pneumonia, VAP, surgical site infection. The committee monitor 4 key parameters like catheter associated urinary tract infection, central line associated infection, bloodstream infection, ventilator associated pneumonia, and surgical site infections. Outbreak management. The committee is responsible for rapidly investigating and managing any outbreaks of nosomial infections to prevent further cross infection among patients and staff. Infection control team. The infection control team to execute the daily practical requirements of the HICC policies, hospitals deploy an infection control team. That leadership, this team is headed by an infection control doctor, typically the microbiologist who takes day-to-day responsibility for infection control policies. Key personnel, the infection control nurses is central operational member of this team. Daily functions of this team. Daily function, the team monitors daily hospital hygiene practices, educates all hospital staff on microbiologically safe procedure, and provide direct advice to the broader infection control committee regarding policy formulation. Coordination. To ensure that policies are both rationally based and actual practicable, the team maintains close working links with the microbiology laboratory, various clinical specialties, and essential support services like laundry, pharmacy, and engineering. So, Hospital Infection Control Committee, the composition of the committee with medical microbiologist, clinical representative, nursing representative, sterile service manager, purchasing officers. 4 roles and responsibility: formulating and monitoring policies, active surveillance, and committee should monitor 4 key parameters like catheter associated urinary tract infections, central line associated bloodstream infections, ventilator associated pneumonia, surgical site infections, and outbreak management, infection control team, leadership, key personnel, daily function, coordination.